Hi Bridget, I'm Michelle.
Hi, nice to meet you.
Nice to meet you.
Look, Michelle, the reason that I'm here is I'm looking for a doctor that a general practitioner, but I'm looking for somebody that is going to look at the whole of me. And you know, I've had a doctor in the past, and it was fabulous. You know, they picked up you know, some of the issues that I've had health-wise, but I tended to feel that it was more about looking at the symptoms and rather than potential causes. And I guess for me, moving forward, I just want to make sure that I stay well. So I want to do whatever I can to prevent getting sick again. Can you tell me, you know, what an integrative doctor does?
Okay, so I guess an integrative doctor always generally tries to look at the whole person. The difference between, I guess, a general practitioner and an integrative general practitioner is that we tend to space our appointment times differently, so we do tend to give you a lot more time. We also have extra training in things like mindfulness-based meditation or mind-body techniques or nutritional medicine or what we call functional medicine, which is really looking at the underlying biochemistry of the body. And we're very much focused on making sure that the diet that you are on is supportive of both the disease process and also in terms of adding to preventative measures that you can take. So, for example, in terms of cancer, we really do spend a lot of time talking about diet, lifestyle, you know, things that you can do with your lifestyle, meditation and mind-body medicine techniques, which are really well researched and have got some scientific merit, so that you can feel more empowered with your decisions and that you've got more power in everyday life, rather than waiting just to have, you know, the medicine that an oncologist might give you.
Yes.
We're giving you, you know, the medicine. Food is medicine anyway. So to give you that medicine throughout, you know, your days as you go through treatment. And the other thing about the mind-body medicine techniques is they can really help you to develop intuition and support you in terms of just making you feel empowered in a situation where you're feeling really vulnerable and scared. And they've also got the added benefits of supporting your immune system. We also have a look at, you know, different aspects compared to different cancers as well. So there's a few technical, you know, things that we look at and a few nutritional aspects that we really look at that help to both stabilise or even treat the cancer itself.
When I went through chemo, I changed my diet to vegetarian and did a lot of juicing of vegetables. I believe that it helped boost my immune system and repair the cells. What's your view on introducing a vegetarian diet during chemo?
Well, certainly a high vegetarian diet, and it doesn't have to be strictly vegetarian, but a high vegetarian diet will, if done well, will increase your antioxidant level through food. And when you go through chemo, it is a stress on the body's nutritional reserves. So if you can replete the body with nutrients through both the diet and perhaps through supplements, you're going to help prevent side effects. And there's a lot of research to actually show that. For example, vitamin C tends to help with chemotherapy side effects, and glutathione, which is a key antioxidant of the body, helps to reduce down chemotherapy side effects. You know, as does, you know, B-group vitamins. You know, all of those kind of things we can assist in to help people cope and go through chemo better.
Okay.
And the other thing, of course, is like meditation and looking after yourself and holding on to, you know, some personal integrity and empowerment as well, you know, when you're going through such a difficult process.
How did you go from working as a general practitioner to this more integrated approach? What happened?
Well, I think like most integrative doctors, there's a personal journey involved, and I have to admit I probably never really worked as a straight GP, or only did it for about a year. And I stumbled upon a conference called the Holistic Health Conference back in 1999, you know, a lot of my peers there's Ian Gawler there's Mark Cohen, there was Ian Brighthope and a couple of other leaders within that field, and really, you know, that holistic approach and the integrative approach just, I guess, you know, gave me goosebumps, and, you know, it was what I was looking for in terms of my practice, and it certainly helped me. So I implemented a lot of their strategies of meditation and dietary changes and avoiding these kind of things, and I've certainly seen a benefit in my own health. And then, you know, you have to share it with everybody else. You can't you can't keep it for yourself. And I think too, you know, a lot of medicine, I've always seen medicine as both an art and a science, rather than just being bogged down with only science. And that art is about, you know, communication and the mind-body connection and the personal connection with people, but also about, you know, common sense and general common sense, you know. So diet interests me greatly, and looking at our, you know, just the way our gene makeup is, and, you know, it makes sense to really push diet rather than just assume that people have got a good diet if they tell me that they have. And really working, you know, really intensely. If somebody's got a significant disease process, we have to really use that food and those diets as our medicine, and we really have to be strong about it. And I think that helps in terms of motivation, that I've done it before. And I've had some assistance with that, so I can help people do and make those changes.
Okay, and so just in terms of breast cancer and the type of breast cancer that I have, and Michelle and I have had a chat about my history. You know, some of the tests that you would recommend for breast cancer, or maybe me in particular, those just to check my ongoing wellness.
Well, often when you've got an estrogen receptor positive cancer, it means that we really need to be careful about the amount of estrogen within your body, which is often why people advise something like tamoxifen, which is an anti-estrogen agent. But there's more that can be done. First of all, estrogen is a hormone in the body which gets made within the liver and then gets broken down by the liver. And so working on liver health as well and making sure that you're breaking down your estrogens effectively is another way that you can do that. And there's certain nutrients that are involved in that, and there's certain pathways that can be enhanced by what we eat and also what supplements we might use.
Okay, great.
And there's also other nutrients that, you know, which is not involved in estrogen, such as iodine is very important for breast health, and folic acid is very important for breast health. So we'll look deeply into them to see whether you've got a deficiency in those. And then also you've got to look at cancer per se. So vitamin D has got a lot of research, and likewise selenium. So we look at those nutrients and minerals that can be, you know, possibly be assisting in that way, either through diet or through supplementation, depending on what we find.
And if there was a deficiency in one of those areas, could that increase the chances of a reoccurrence of a cancer?
Well, quite potentially. I think, you know, we do know a lot about cancer, but we also don't know a lot about certain things. And I think it's really important to take a really broad approach. The thing about nutritional medicine is it's incredibly safe. It has a very, very high safety aspect to it.
Yes.
And so, you know, for example, what we know about vitamin D is that it's an immune stabiliser. It's a very important antioxidant and has some anti-cancer effects. So if somebody comes in with a deficiency of vitamin D, I can't say for sure whether having a replete optimal vitamin D is going to do anything to the outcome of cancer.
It could be also,
but it certainly makes sense and common sense to use a very cheap, safe, you know, intervention, and, you know, and not take our chances with running around with a low vitamin D.
Yeah. And just on vitamin D, so vitamin D, the first source of that comes from the sun, doesn't it?
Yeah.
And, you know, I mean, sometimes we don't get enough of that vitamin D because our whole body isn't exposed to the sun, you know, and that's what my understanding is.
Well, that's right, and we're also using, you know, the SunSafe campaign was incredibly effective at reducing down our sun exposure. but there's some questions of whether we've gone a little bit too far, and I think, sun exposure and vitamin D that you get from sun exposure has been very important in terms of maintaining our levels for bone health, heart health, brain health, and as an anti-cancer agent. So we need to have safe sun exposure. Mm-hmm. So in the early hours of the morning or the late afternoon, having a little bit of sun exposure where we take our clothes off and we expose our whole skin to the sun. It's a really pleasurable thing to do, but we certainly want to avoid, sunburn and over sun exposure where the sun, the skin is drying out and getting damaged from the sun. So it's sense of moderation, which is really important. But also when we're under oxidative stress, which is a kind of chemical stress within the body, we tend to use up our antioxidants, and vitamin D is one of them. And we've also had some changes in our oil components of what we eat. And so vitamin D is a fat-soluble oil, and we're tending to kind of go away into more highly processed oils, and that's depleting our vitamin D too.
Great. Okay, thanks for that.